turn to the battle over Obamacare. Late in the day, the Justice Department said it'll file a petition asking the Supreme Court to consider the constitutionality of the bill. Also, front page stories in the New York Times and the Wall Street Journal, a 9% rise for health insurance premiums. That's the biggest in 4 years. Did Obamacare drive up those rates? Let's talk to our distinguished guest, Igor Volsky, co-author of Howard Dean's Prescription for Real Healthcare Reform, and Betsy McCaughey, author of the book, The Obama Health Law, What It Says and How to Overturn It. Betsy, just start with you. I want to get to the insurance hike, but on this issue, the DOJ, Department of Justice, will now let the Supremes deal with Obamacare. How long will this take? And I know you want them to overturn it, but how long? What's the time frame here?
It's likely we'll have a decision before the presidential election.
All right. And if you had to bet on it, Igor, what do you think?
Well, I think the court's going to uphold it. We should know by June. You know, Justice Stevens said yesterday he thinks it's unconstitutional. He pointed to actually Scalia precedent. So I think the law has actually a lot of good allies on the court.
Yeah, Betsy, you don't agree with that.
No, of course not. This involves the most fundamental question of how much power the federal government can have over an individual. And never before has the federal government been able to force Americans to buy any product. If they can do that, they can force you to do anything.
And Igor, let me ask you, my friend, wasn't it the expectation of Obamacare that's driving up these health insurance rates? All of a sudden, we go back to 9%. We've been running at 3%, 4%, and 5% in recent years. I think we might have a chart of it all. What's going on here? Obamacare's bending the cost curve higher, not lower. Look at that chart.
Well, Larry, I think anyone trying to blame a law that doesn't go into effect really until 2014 is barking up the wrong tree. What you have are insurers requesting double-digit premium hikes at a time when Americans are using less care. They're increasing profits while spending less on health care. And the good news here, though, in that same report, you saw 2.3 million young people join health insurance rolls. And now businesses are saying that next year they're expecting a smaller increase because you have a lot more younger people, healthier people, balancing out the sick people. So I think as reform is implemented, you'll see those numbers decrease.
No filibustering. We got to go short. Go ahead,
Let
Betsy.
me point out the early provisions of this law, kids on their parents' plans till 26, eliminating the annual caps on payouts, and no co-pays for preventive care, have pushed up premiums. There is no tooth fairy.
That's a small price. That's an investment for future savings.
Secondly, let me point out that even bigger premium hikes are ahead, because in 2014, employers will have to provide the essential benefit package. And for example, the CEO of CKE Restaurants, a 3,200-unit chain, just told Congress in testimony that it will increase his health insurance costs 150%. Even these early provisions are why 1,472 large employers and unions slithered to the White House for waivers from these very costly early provisions.
But Igor, even the Kaiser Foundation that publishes these numbers, even they said at least 1.5 percentage points of the 9 percentage point increase has come from Obamacare, and that's probably a low ball.
That's a very low ball,
Those
Larry.
are small. That's a small increase. That's about 17% of the 9%. Everything else is about underlying health care costs and insurance premiums, which the Affordable Care Act will begin controlling. But look, these are investments, bringing young people into the risk pool to make sure we're not paying for it when they go to the emergency room is a good thing. Making sure people get preventive care, again, so that chronic condition, those expensive chronic conditions don't develop. Those are all savings over the long term.
But Betsy, I'll give you the last word. Isn't this, though, when Obamacare kicks in, you're going to have price controls and rationing. Aren't the insurance companies sort of defending against that in advance?
No, actually, the real reasons these premiums went up and will continue to go up is, number one, that people are being required to buy a health plan that includes more, and secondly, the vast expansion of Medicaid. Medicaid pays 86 cents on a dollar.
They're going to go down with competition in 2014.
Hospitals and doctors have to shift the care onto the privately insured.
Igor Volsky and Betsy McCaughey. Sorry, we don't have more time. Truly.